So one of the very common questions that I see all the time on social media is, should I go to a chiropractor? Well, everyone, this is Dr. Heather, your virtual sports chiropractor, and I kind of wanted to go through that question a little bit further for you guys because it's really kind of an interesting story on how chiropractic medicine came to be, and also to give you some better knowledge on what chiropractic is and what a chiropractor does. Now, if you're not familiar with chiropractic medicine or a chiropractor in general, but somebody has recently said to you, hey, I think you should check out my chiropractor, or you've kind of questioned whether or not that is a practitioner that could help you a little bit further with what's currently going on with you, then let's get right to it. Now, back in 1895, pretty much, D.D. Palmer, who is the founding father of chiropractic medicine, went ahead and came across a deaf janitor and wound up doing an upper cervical adjustment, which simply meant he was adjusting the very first cervical vertebrae in the neck. And that deaf janitor got off the table and wound up being able to hear again. Now, granted, there could be a million reasons why all of a sudden the janitor realized that he was able to hear, but the whole premises behind that original adjustment that D.D. Palmer had actually done was around the fact that our spine itself has a bunch of nerves that come off of it. So as you can see from the diagram I left you guys here, if we look at our spinal column, you can see there's a host of nerves that come off it. It actually acts like a giant tree where you see all these different kind of limbs going out off to the side from what we call the central nervous system. So it was D.D. Palmer's kind of premises that if you went ahead and did some adjustments to the actual spine, you would go ahead and increase that neurological response. You would decrease interference throughout that spine and allow for someone to heal faster. Now, he had a son named B.J. Palmer, and B.J. is the one who really catapultized chiropractic, bringing it into the 21st century, or I should say the 20th century, by really starting to get some more scientific base and legal-based information regarding how chiropractic works and actually all the different techniques that could be used by a chiropractor. Now, again, back in probably like the early 20s and so forth, you could hear some stories that chiropractors were actually jailed. That's right, they were actually put in jail thanks to the American Medical Association and community, based upon the fact that everyone thought chiropractors were a bunch of quacks. Now, granted, we're not a bunch of quacks, but back in those days when that did occur and chiropractors were put in jail for practicing chiropractic medicine, patients actually wound up going to those jail cells to get their treatment. Kind of a little strange story, but very true. Now, again, looking back at the history of chiropractic medicine and really kind of starting to understand the fascination behind what we call innate healing. And that's really kind of looking at that intuitiveness that we may have where we kind of say, hey, something doesn't feel right, it feels wrong. So this is that premises too, that chiropractic takes on this holistic approach by really looking at not just the nervous system, but the musculoskeletal system in general. So really understanding how our body moves, functions, and then being able to alleviate pain and discomfort by utilizing our body to heal itself. Now, again, chiropractors perform manipulation. Now, there are other doctors that perform manipulation as well in terms of osteopaths and actually some PTs. But our manipulation is a little bit more specific. It is actually very geared towards that particular segment that has gone ahead and misaligned itself. Now, again, back when D.D. Palmer was first kind of out on the scene, along with B.J., they would use the word subluxation. Now, there is a big discrepancy between the medical community and the chiropractic community because the medical community does use the word subluxation as really as a bone out of place when we think of like a dislocation. Whereas chiropractors use subluxation to more mean about vertebral subluxation. And that's simply where you see the vertebra just moving in a direction or becoming misaligned from its counterparts above and below that segment. Now again, a chiropractor does perform manipulation. Now a lot of times chiropractors could use a host of different techniques, which we'll go into in another video, but for premises of this video, understanding that chiropractors are there to really kind of help you heal your body, but they can use a host of different types of treatment modalities, anything from different various physical therapy modalities to nutrition to exercise, therapeutic exercise, corrective exercise, as well to kind of get your body back and functioning. Now again, chiropractors, we do a manipulation service, meaning when you come in, do expect to hear a few cracks, a few pops, because guess what? When we release a joint and a bone, goes ahead and wants to realign itself, get properly put back into place, you will hear what's called a cavitational release. That's essentially like a suction cup against a window when it pops. So there's nothing wrong with actually getting an adjustment, but it's very important that your chiropractor does do a good history, because you want to make sure that your adjustment is being done correctly for what's going on with you. Now, if you're not really familiar with the different types of techniques, or if there's a specific type of technique that should be more done on you based upon your condition, always feel free to kind of drop some comments down below and ask away. But like I said, I'll address that in another video. So guys, like I said, the history of chiropractic is very unique, but chiropractic medicine is a very holistic approach. It's really kind of taking a look at your body and how we can best heal it without the intervention of drugs. Now granted, there are times and places to use anti-inflammatories and steroids and so forth, but for whole purposes, chiropractic really does look at healing the body in a very natural way by looking at supplementation, vitamins, and again through manipulation designed around really increasing your neurological flow, your blood flow, and your lymph flow. Because again, all of our body, that whole entire trunk of our body, that central nervous system that runs through, everything else that comes off of that, those nerves that branch out. Again, everywhere where there's a nerve, there's a vascular supply, there's a lymph supply. So if we know that we're going to correct one of those misaligned segments, chances are you're going to notice some increased vascular flow and lymph flow. Very similar to kind of Chinese medicine when we look at meridian levels and when we look at soft tissue work through a very good massage therapist. Chiropractic is a fascinating approach to take, but again, you have to find a chiropractor that's going to work right with you. There are very different types of chiropractors out there in terms of some only focus on subluxation base, while others take a holistic approach, while others may actually do an energy type healing, and while some, just like myself, do something more along the sports avenue. Now, a subluxation based chiropractor is only going to be adjusting your spine. So just be aware of that. If you're going in with hip pain, elbow pain, knee pain, chances are they're going to really focus in on your spine. Now, somebody who does a little bit more energy healing is going to be taking a very different approach, so your mind needs to be wrapped around that type of technique. And if you're somebody who is an athlete, you're definitely going to want somebody who does focus more on extremity injuries and looks at misalignments and adjustments to those extremities. Now guys, again, this is just a quick little overview on what chiropractic is based upon somebody possibly suggesting that you see a chiropractor or for your own based knowledge. Now again, the history of chiropractic, we could go on and on about the philosophy here, but it is a fascinating story. If you want more information, drop some comments down below, and if you found this little video helpful, give it a like, and don't forget to subscribe to the channel. I'll talk to you guys in the next video.